Did you know that many people in Uganda have sexually transmitted diseases and they do not know that they have them? Because some sexually transmitted diseases do not show any signs until serious danger has happened. So today we shall discuss about sexually transmitted diseases. We look at common signs that people ignore. We look at common STDs that affect Ugandans, and on top of that we discuss prevention measures of all these sexually transmitted diseases. My name is Nomamanya Davis. I'm a public health practitioner and I'm a pharmacy technician. So, as I told you earlier, I work with Health Matters Uganda. In Health Matters Uganda, we bring you different health conditions, how we can prevent those conditions from affecting the health of Ugandans. So, we shall look at sexually transmitted diseases. These are diseases or infections that are spread through sexual contact. Now, most Ugandans get signs of sexually transmitted diseases, or what we can abbreviate as STDs, and they do not go for treatment. Let us first look at why Ugandans do not want to go for treatment of STDs or even check up as early as possible. One of the reasons why Ugandans do not test for STDs or do not go for treatment for STDs when it is still early is stigma or fear. Most Ugandans feel ashamed or embarrassed to go and test for these diseases. Now imagine someone can get an STI and feels ashamed to go to talk to a doctor or to a friend, because these people think that they will be misjudged by the doctors or the friends or whatsoever. And this thing has led these STDs to remain in Uganda, because these STDs can come at early stages, and if you do not search for treatment when it is still early, you may get serious complications. Now, another reason why people do not want to go for early treatment, it is lack of awareness. People do not know these signs. Most people don't know the signs. So as Health Matters Uganda, that's why we come to teach Ugandans. We tell them different diseases, how they present, and how you can prevent them. So we shall equip you with this knowledge so that you get to know the early signs of STDs. Other people do not go for treatment because they fear healthcare costs. They think going for healthcare treatment or guidance about STDs, it is very expensive, and it is not. So as Health Matters Uganda, we come discuss all of these factors affecting Ugandans. So we shall begin by looking at common signs of STDs. So the moment you realize any of these signs that we shall talk about, just know you have an STD. One is abnormal discharge, either from a vagina for the case of a woman, and for the case of a male, abnormal discharges from the penis. The moment you realize that there is something coming out of your vagina and it is not normal, like it has not been there, just know you have an STD. Another sign we shall look at is painful urination or pain when you are urinating. Some people complain that when they are urinating, they feel a lot of pain, and that is a very, very dangerous sign of STD. Others feel every time they want to be scratching their private parts, itching in the private parts. It is also a very dangerous sign of STD. So we shall look at very many signs. There is also a sign of sores in the private parts. You get some wounds or ulcers, you can call them ulcers or sores in the private parts. That sign is also very deadly The moment you realize that you have blisters in the private parts, also it is a dangerous sign of an STD. So having looked at those signs of STDs, we have to go further and we look at different STDs and how they present. To begin with, we shall first look at HIV or AIDS. That is a very common STD that almost everyone knows. But for HIV, I will organize another episode designed for HIV only. We discuss HIV further. We see how it presents. We see how we can get a treatment or we can get a diagnosis. And we see preventive measures as Health Matters Uganda we always advise, because for us at Health Matters Uganda, we believe in prevention. We know prevention is always better than going for treatment. So for HIV, we shall organize a full episode later. Today we shall talk about these other STDs. For example, we shall talk about gonorrhea, the most common one. Most people know this gonorrhea, the one you know as Enzuku. So this gonorrhea, how does it present to us? Or how do you know that you have gonorrhea? One, if you have past discharge or abnormal discharge that is either yellowish or greenish, that is a common sign of gonorrhea. Anyone with that sign, just to know you have already contacted gonorrhea. Another sign of gonorrhea is burning sensation when you are urinating. Sometimes you feel like you are urinating fire. That is also a very dangerous sign of gonorrhea. Another sign of gonorrhea can be pain in the lower abdomen for the case of women. And these signs, the moment you see them and you do not seek for early treatment, it can be very, very dangerous. It can cause serious complications. For the case of women, it can even cause a miscarriage. So before you get any of these signs, we encourage you to always aim at preventive measures. But the moment you see these signs, always look for early treatment from trained health personnel. Yeah, this episode is proudly sponsored by Magara Pharmacy. It is located in Mbarara, in Rwebe Corner. You reach out to Magara Pharmacy Rwebe Corner. They give you treatment for most of these diseases. They give you advice on how you can use those medications, and above all, they give counseling for all diseases. They do pressure checkups for free. Go to Magara Pharmacy Rwebe Corner and get all these treatments. So we are still discussing about STDs, and we have looked at gonorrhea. There is another STD called syphilis. So this syphilis, how does it present? How do you know that you have syphilis? One, syphilis, you might get blisters. You can get sores in the private parts, but those sores are always painless. So you have some wounds there in the private parts, but your wounds are not so much painful. So that is one sign of syphilis. Another sign that can show that you have syphilis, you might get rashes around the foot. You get rashes there, even in the hand. Sometimes the rash is always there. So the moment you get that sign, just know you have syphilis. And for syphilis, if you do not get early treatment, it is very dangerous. It can even affect your brain. It can even affect your heart. So the moment you see any of these signs, kindly reach out to health professionals for further treatment. Another sign of, or another STD that we shall look at today, there is chlamydia. Chlamydia, most of people live with it because for it does not show early signs. Until it is too late, that's when you can get signs of chlamydia. One of the signs is painful micturition. You feel a lot of pain when you are passing urine. That is one sign of chlamydia. Another sign, it comes with the lower abdominal pain. Also, chlamydia can cause blisters around the private parts. So we shall look at another STD today, and that is genital herpes. Yeah, there is genital herpes also can be a very, very dangerous STD. With genital herpes, you get painful blisters in your private parts. Unlike for syphilis, the the sores you get are not painful, but with genital herpes, the blisters are always very, very painful. You get painful passing of urine, you get lower abdominal pain. So we encourage you to always get treatment earlier or get these preventive measures to avoid complications of these diseases. I told you one of the complications of these STDs is a miscarriage. That is very, very dangerous. And I told you for syphilis, you will always get problems with your heart, problems with your brain if you do not treat it. With the genital herpes, for it is a viral infection. So the moment you get it, just know you will live with it. It has no cure. So that's why as Health Matters Uganda, we come to give you these prevention tips so that we can always live healthier instead of going for treatment, because some treatments are not effective. Even with HIV, there is no permanent treatment for HIV. Like, you will go on to medication, you get healed. I hear some pastors do heal HIV, but for us as medical professionals, we shall always tell you that HIV has no cure. So, on top of that, we are interested into prevention mechanisms. How do we prevent these STDs? Number one, maintain regular use of condoms every time when you are into sex. That is a very, very powerful weapon you can always use. Use of condoms regularly and full time. Do not put a condom for 5 minutes, then the rest of the time you have removed it. You have not used a condom. So use of a condom is very, very effective. Another way we can prevent these STDs is abstain. If you can do abstain, or if you cannot abstain, avoid multiple sexual partners. Get one partner, do with her, do regular checkups for all these STDs. Can be checked up in any medical laboratory. They do checkup of all these and most people always go for testing on HIV. I do not know why. So let us always check for all these infections, because one time I was working in a certain facility and someone who came in just asked for those testing kits for HIV. So I asked him about testing for other diseases like STDs, and was like, those ones are curable. But I told you that genital herpes are viral, it is a viral infection. So you want to get it cure. So let us keep these prevention tips with us so that we do not get serious complications, and so that we do not waste a lot of money on treatment. As Health Matters Uganda, we always advise treatment, advise prevention more than treatment, because in our previous episodes we are looking at how prevention is better than treatment. You can visit our YouTube channel at Health Matters Uganda. You go and watch all those episodes. We always discuss different health conditions and how we can prevent them. So another way we can prevent these STDs is to avoid multiple sexual partners. You have one sexual partner is enough. So the more the number of sexual partners, the higher the risk of contracting these STDs. Another way you can always go for checkups when it is still early. The moment you see any sign, go for treatment. Before you get to those signs, always go for medical checkups of these STDs to avoid contacting them. So we looked at how we can always use condom, how we how we can always have one sexual partner. Then we look at also getting early treatment for these diseases. Then we shall look also at vaccination. Some of these STDs can be prevented through vaccination, like HPV. You go for that HPV vaccine for ladies. You prevent yourself against this. You immunize against HPV. You will always be safe. So Magara Pharmacy is the one sponsoring this episode, and we have so many health conditions to discuss about. Follow our channel at Health Matters Uganda for more videos. If you find this information useful, please always subscribe to our YouTube channel, share and like, comment any health condition that you would like us to discuss next. Thank you so much. See you in the next episode.